like me, I know I handle things in my life. I handle it with God.
What are some common misconceptions about menopause and what is the truth behind them?
It means that that dot of blood I saw has nullified all the 9 months. If they call many people today, very few people will say, well, I'm going to work because I just want to be a blessing to people. There are many things that you don't actually like doing, but if you know that it benefits you, that it can do you good, you just have to have a way of saying, okay, how can I make this happen? The husband just needs to be considerate and understand.
Men that is going to listen to this, support your wife when they are going through menopause. How does menopause impact mental health and what coping strategy can help women navigate emotional changes?
Yeah, I would say that, like I said earlier on, like me, I know I handle things in my life. I handle it with God. But if I want to advise, like medically and all those, I will advise you to go to your GP. Go to your GP because sometimes they will assess you and say, okay, what are the symptoms? What are the impact of those symptoms on your health? Is it minimal? Is it moderate? Or is it high? If they see that those symptoms are actually high and they can actually lead to something permanent, like permanent damage or permanent situation in your life, then they can put you on therapies. They can refer you to probably, perimental health. They can refer you to probably they can even say, okay, let's give you this hormonal treatment. It depends on the assessment of individuals. The GP will assess you. They can refer you to different, probably health, professionals to see, to now come together and say, okay, how is this period affecting your life as a whole? So when they get the report from those people, that will now determine what they do for you, whether the GP will put you on the HRT, the hormonal treatment. Because some people, when they have the hormonal treatment, it actually changes everything.
Okay.
But then the hormonal treatment too might have its own, opposite side.
I got the question. Pros and cons of using this during.
There's the side effects and everything. But the GP will assess what you are going through right now. How is it affecting your life, your day-to-day living, and is it worth giving you the hormonal therapy, or is it worth you just going through it while you manage those symptoms individually, naturally, and maybe with supplements, or those things, are they going to lead to permanent damage? So if they say that it's going to lead to permanent damage or it's getting worse and you're not able to cope, and you are mentally, drained and this and that, they might actually put you on the therapy. But there are many things that are available with the GPs. So if you are going through it, just go to your GP, explain to them, and they'll be able to assess you, and they'll be able to give you the treatment that you need.
Wow. Thank you very much. You covered that question. I'm going to still ask another question. So, what are some common misconceptions about menopause and what is the truth behind them? You see, I think sometimes a lot of women feel shy about saying I'm in my menopause now, or is it perimenopause? So some women, they are a bit shy about it. So what are the common misconceptions about menopause and what is the truth behind them?
Well, it depends on, but because me now, I can say I'm perimenopausal because my period, I didn't see for about 9 months.
Wow.
And all of a sudden, I just saw it like a spot just one day, and that was it.
And finish.
And it disappeared again.
Mm.
So it means that all the 9 months that was thinking, oh, 12 months is coming. Oh my God, yes, I'm going to reach I'm not going to see that period again anymore. It means that that dot of blood I saw
Mm.
has nullified all the 9 months.
Wow.
I need to start counting my 12 months
Again.
from the day that blood came.
Really?
Yes,
Oh my good God.
yes. So, to me, I'm not ashamed. I'm going to be 55 this year,
Wow.
and I'm happy that I'm 55. So
Praise
if I'm happy for how far God has brought me, why should I be afraid? Why should I be shy to tell people about what people go
menopause.
through at this
Mm-hmm.
period?
Mm-hmm.
It's
Mm-hmm.
like I said earlier on, it is normal.
Mm.
It is a normal phase of life. It's just like if you get pregnant after you've gotten married, are you shy to show that you are pregnant?
If there's no ring in your hand, you will be shy, yo.
No, I mean after you've gotten pregnant,
I mean,
after you've
you
gotten
get
married,
married. Yeah. Some people,
after
if
you've
there's
gotten
no
married,
ring, some people that don't like wearing ring like mine, they might say, "Oh, she's pregnant, she's not married." But you will not be, you not be ashamed, isn't it?
that's it's up
Anyway,
to the
that's
person.
just yeah, yeah. I'm just putting that into
It's
it. You
it's
won't be
it's how
ashamed truly because you are married
it's
and you are proud of it.
exactly, yeah, it's how you look at your pregnancy. If
Mm-hmm.
you are bold enough to bring your pregnancy out, that
Mm-hmm.
I'm carrying a baby. Some
Mm-hmm.
people are not bold enough. I mean, they do abortion, they do all those things so
And
that they
that's
will not, people will not see them be pregnant. So if
mm,
you can keep that pregnancy, it means that yes, you are proud of the pregnancy. There is nothing anybody can do about it. So you must not look at people that, oh, maybe they would think, I'm happy that I'm getting old, and I thank God for what God has done in my life, you
mm-hmm.
know, till now. So nobody should be ashamed of perimenopausal is a normal stage of life.
No, yeah.
Is the normal process. I mean, process that body have to go through. And you didn't create yourself.
Mm-hmm.
It's something that God has set in place to happen. So why should I be ashamed of what God has set in place to happen?
To happen.
So nobody should be ashamed of it. And it's like you said, it's what because people are they. I don't think because they are ashamed, that's why they don't talk about it. I don't think so. I don't
Mm.
think people are ashamed of it. Yeah,
Maybe it
because
could be people will be looking at them as if they are getting older, or
well, whether you go through
yeah.
menopause or you don't go through menopause, people can see that you are getting older.
There's nothing you can do
When
about
they know your age, when they see your age, they see your children, they see that your child is 30 years old, 35 years old. But there are many
it.
things
Exactly.
out there that show people that you are getting older, that this is probably your age.
Mm.
So I don't think that should be something that people are ashamed of. I'm not ashamed of being of growing. I mean, thank God some people would have loved to be alive today to see themselves being 50,
Mm.
60, 70, and 80. So why should I be ashamed? You
It's
know,
true.
people must not be ashamed. And that's why some people will go through it without knowing that that is what they're going through if they don't say it out.
Mm.
Because they don't say it out. So that somebody who has been through can say, is that what you're going to do? This is what I've been through. It was because my colleagues said it that, look, this was what I was going through, and my GP had to run some tests on me. That was when I realized that, oh, could it be that? Could it be what I've been going through?
True. Mm.
Do you understand?
Yeah,
So
very
I
true.
don't think there should be anyone, I mean, there should be any shame about it. You know, people
Mm.
should be happy that they are going through it and
Okay.
go through it with joy, you know.
Joy in pain.
Yeah.
Thank you. Thank you for that. So, how can regular exercise benefit women going through menopause, both physical and emotional exercise? I don't know, is there any emotional exercise? So, how can regular exercise benefit women going through menopause, both physical and emotional? And yeah, let me just put it that way because I want to say, what about women that don't like exercise?
Wow, they just have to. You just have to. It's just like now. Nobody likes going to work, but we go to work before we know that because we know that. we have to put food on the table.
Mm-hmm.
I mean, we know that we have to pay bills.
Mm-hmm.
You know, if they call many people today, very few people will say, "Well, I'm going to work because I just want to be a blessing to people." You
Mm.
know,
Yeah.
and even when they go, they don't go just to be a blessing. They know that at the end of the month, they want their salary in their bank
Mm.
account.
Mm.
So there are many things that you don't actually like doing,
Doing, but you
but
have.
if you know that it benefits you,
Mm.
that it can do you good, you just have to have a way of, okay, how can I make this happen?
Mm.
You have to think, okay, if I do this, what effect will it have on me? If I don't do it, what effect will it have? So it depends on what you want. If you don't do it, it's just like you just leave like if you don't exercise our brain now,
Mm.
you are not reading, you are not studying, you are not doing anything. At the end of the day, you realize that that brain will stop picking things up. Something that they're supposed to pick up and say, oh, okay, it will just, it will function less
Mm.
if you don't exercise your brain. Whatever you don't exercise will function less.
Okay.
If you don't exercise your legs, like you're not taking a walk around, let's go for 30 minutes walk, and you're just lying in bed, before you know it, the bones in your body, in your legs, the tendons, everything, they will be relaxed
Mm.
because they have not done work for a long time. And that's why when you see people in the hospital, maybe they have been in coma for years and for days or for weeks. When they get up again, they
Mm.
start doing exercises for them. Physiotherapy has to take over,
Mm.
start teaching them, to walk, because their body has not done that job for about maybe 2 weeks or 3 weeks of
Mm.
being in bed
Mm.
without being aware of themselves.
Mm.
So you must make sure that your body is active,
Mm.
that you're active, you're doing exercise, even if it's just like 30 minutes,
Mm.
you know, maybe around in the house. Some of us, maybe when you pray, we don't just sit down there praying. Even for maybe that 1 hour, walk around,
Mm.
that's a form of exercise.
Mm. Yeah.
You know, because people do jobs that almost they are like when I used to be on the ward as a midwife. Now I work in the office. When I used to, I mean, we can be on our feet for 13 hours,
Mm.
just walking, running around. Da, 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 da. For me, that is exercise for me.
Yeah. Sure.
So it depends on what you do. If you do a job that's just in the office, sitting down, and you're not walking around, it means that you have to create time for yourself to say, okay, this time I have to do exercise. About 30 minutes. Some people do it for maybe once in a week, or twice a week, or 3 times a week, or every day. Some people do it every day.
Mm.
So the more you exercise every part of your body, I would say,
Mm.
the more functional they are.
Mm.
And the more you exercise your brain, though that the mental exercise is, read something, go for seminars, go for, if you go to church, just meet with people, you know, talk with people around, just don't be a loner. Don't sit in the house, call up people, talk to them. Oh, how are you? Things, this and that. You can share testimonies with them. You
Mm.
can talk to them about yourself, like, oh, this is what it has been happening with me. Just mentally, don't just sit down there, because at that stage, sometimes you just want to be alone.
Mm.
You just want to be alone, and that can actually lead to depression. It can lead to a depressive state where you just permanently want to be alone. But instead of that, exercise your mental, your mental health. Just talk to people, read, study. If you're a Christian, praise and worship, dance in your house. You are alone, but you are still dancing. You're putting, all
Mm.
those things. So there are many things that you can use, to improve your mental health and to improve your, physical health.
Yes.
Like I said earlier on, your diet,
Mm.
rich food, balanced food rich in, good cholesterol.
Yeah.
You have two
Yeah.
type of two cholesterols. You have bad cholesterol. You have good cholesterol. So you can eat food rich, rich in, good cholesterol.
Mm.
Your dairy, all those is nuts. In peanuts is a good, health advice. So all those things, just if you can go on Google, you can go to your GP. If you want, you can go to a nutritionist. You can, so that they can advise you on the kind of, food to eat. But I can trust, just trust me, you can be healthy.
Mm.
While you are going through it, you can still stay healthy.
Mm.
But just knowing that it is a phase that you are going through. And
Mm.
that phase is not forever, it's not permanent. It's
Mm.
gonna be over.
Mm.
Yeah.
Wow. Thank you so much. Yeah, the next question is I know you mentioned it briefly, just briefly. What are hot flushes and why do they occur during menopause? I had met a lady, she's a carer. She was talking to me about hot flushes, and I know a lot of people mentioned that to me. So, how does it feel? I don't experience it. I don't know. And I don't want to. I'm praying about it now. God, I don't want menopause signs. Let it just stop him and I'm happy. So, what are hot flushes? How do they feel like? I know somebody was telling me, is it the one you go to toilet regularly? I don't know. What are hot flushes? Why are they? Why do they occur during menopause?
Mm. Um, well, hot flushes, they occur in menopause, like I said earlier on,
Yeah.
because of fluctuation in hormones.
Hormones. Okay. So how do they
Fluctuation of
feel? Is it
estrogen.
like something hot coming out of you, or is it like a urine?
No, it's a feeling that you might not understand until you go through it.
I'm not going through it.
No, I'm just until one goes
I
through
know
it, you
when
don't
people
know
go
what.
say, yeah, I don't, yeah,
Because
I'm just saying that.
before this stage,
Mm.
when my colleague says, "Oh, flush, Margaret, what's this talking about?" it will be in the cold weather. They will put fan in front of them, and
Oh,
you see them sweating,
okay.
sweating, 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 sweating,
Mm.
and beyond the sweating, there is a feeling, that something that you feel. You feel that you're feeling hot, like your face is feeling hot from inside, and the result of it is you see sweat. You see like sweat coming out your face,
Mm.
and it happens in the upper part of the body. Your chest will feel hot, and you will see like there's sweat there. So
Mm.
that is off flushes, yeah. But before I started going to, when I see people, I'm like, what is, why are they putting on fan, for God's sake, in this cold weather? So I'll just turn the fan to them that, come on, what is this? And I think for some people it's very bad. For
Mm.
some people, you will see them just, draining like lots of, fluids. Why? It is a very cold weather.
Okay.
Yes, yeah.
I
So that's
thought
how.
I thought some people said it's like maybe when you go to toilet too much, or maybe some people said they bed wet as well.
No, that's another. Those are other symptoms that people can have,
Ah.
and it's just because of the estrogen, the hormones.
Mm.
You know, when the hormones, the relaxation of the muscles, of organs, of things in your body that controls firmness, and when the estrogen level reduces,
Mm.
there's tendency that people can, their muscles, the muscles that surround their blood, that can be weakened. you
Mm.
know that's why exercise is very important as well. Like I said, when you do exercise, it actually strengthens, other parts of your body, your muscles, your tendons, all those things.
Mm.
So yeah, so you just have to do exercise. And some people go through that, they can actually bedwet.
Mm.
Yeah, it's just because of the hormones as well.
Wow.
Because the ones that surround their bladder is weakened
It's weak.
because of the estrogen, yeah, because
Mm.
of the hormones. And at that time, you start going to you go to toilet so frequently, you
Mm.
know. And when people do that as well, like I said, it can misconstrue. They can be misconstrued with another disease.
Yeah.
If you go to toilet frequently, it can be maybe it's diabetes or other things. But
Mm.
until you go for tests, and know have the awareness that premenopause can actually bring about those kind of symptoms, then you'll be afraid.
Mm.
So yeah, so exercise is very important.
It is.
It's very important. Yeah.
Wow, thank you. Before I go to my last question, because of you've mentioned quite a lot about these menopause symptoms. I know it's good for some people. Some people is mild. Some people could be the flu blown.
Yeah.
So let's say, for example, because actually it's not part of our question. Before I go to our last question, just give me this answer, please. Men, how can the men now, we're talking about married men, how do you advise them to support their wife when they are going through this menopause? We're not
Mm.
talking about baby people that are single parents, they will, I mean,
Yeah.
nobody they will call on, they are married to Jesus, or they will cope by themselves or talk to their parents or friends,
Even your
But
friend. Yeah.
I'm talking about people in marriage now. Now you see your wife in bubbling ladies, all of you laugh together, you laugh, you do all sort of things together. Now the woman is going through menopause and things that start withdrawing. It's like a woman pregnant, isn't it? So how can we advise men? Because some men could be irritated. Let's say, for example, somebody have this issue of bedwetting. I think I've met a lady have said that to me, that when she was going through menopause, she was bedwetting. So actually, that was what was thinking in my head. I didn't even know it was the hot flushes was the fun thing. And I was thinking it's those people that go to toilet regularly or something. I think, yeah, I've got something now that I don't know before. Thank you, Pastor.
That's okay.
So, like the married women now, yeah, how can their husband support them during
Mm.
this transition? Because it's a transition from, yeah, bubbling lady to now big adults. They are
Mm.
bigger adults. Let's put it that way. Bigger adults. Bigger adults in menopause state.
Yeah. Yeah. Women do need support of their spouse,
Mm,
and that is why their husband need to understand that um she's not just doing what she's doing right now. She's
mm,
not just behaving like this now because she just wants to be nasty or she wants to be different, but because of the phase of life that she's going through.
mm,
So, as women need to be aware of this premenopausal state and menopause, the men too need to be aware
mm,
so that when there's a change in their wife's behavior, they
mm,
will understand that, okay, maybe this is what is happening. Like
mm.
I said, sometimes I'll be feeling hot. I want to open the window. My husband might say, "Hi, come on, it is very cold. How can you open the window in the room? You want to kill me?" But you must understand that that person too is feeling something. They
Mm,
are, in that way, you can say, okay, let me put on many other clothes, maybe a jacket or something, so that this woman can have fresh air.
mm.
Do you understand me? It's
Sacrifice.
about balancing. Yeah.
Mm,
Know that is not it's not permanent. It's not, she's just feeling that way at that period in time. You
mm,
know, that's, but maybe it's just about, sometimes it might just be like maybe about 2 minutes, 3 minutes, sometimes 5 minutes. Some people can feel it for a longer time,
mm,
but sometimes it might just be for about 3 minutes, 5 minutes phase. And sometimes the women can just relax and say, okay, it's gonna be over. It's just for about 2 minutes. You know, let me just go through this 3 minutes, and before you know it, it's over. Because I
mm,
can remember sometimes I will feel that like hot. I'll take off my clothes. I'll take off my, everything.
mm,
So within the next 5 minutes, I'm feeling cold again. So I have to put everything back on again. I have to, okay, you have to put it back on again. So it's the understanding
mm,
that, okay, what she's going through right now, if you want to be helpful, if the spouse wants to be helpful, okay, is it just to open the window for about 2-3 minutes? That's fine by me. Open it and get your fresh air and then shut it again. I think it's just the understanding of what they are going through
Mm.
And sometimes emotionally, when they're a bit low, it's about the husband to understand that, okay, maybe this is it. But then to encourage them, to talk to them, to, and sometimes some women are just tired. They don't go want to go for a walk, whereas the walk is very important for them. The husband can encourage them, come on, darling, let's go for a walk. You
Mm.
know, at least to encourage them as they go through this period. Because sometimes you can feel lonely, you can feel alone, you can feel that I'm the only one going through this and nobody else understands what I'm going through.
Mm.
So the husband just needs to be considerate and understand. That is why awareness to them as well is so important. So that when they are aware, okay, there's a period in the woman's life when they will go through such a thing, and these are the things that they might be going through.
Mm.
So that if the woman said, I'm not eating this kind of food, the husband will understand that, okay, maybe because at that point in time, you need to now watch the food that you eat.
Okay.
You know, it might have way before anything that comes my way. Okay, bokoto comes, shaki comes, and gigiru comes, everything, peppers, everything that comes, you're just munching it.
Mm.
Oh, salad cream, everything. But when you are going through this period, at least as we grow older,
Mm.
we must watch our diet. You
Mm.
know, maybe before you used to take sugar, lots of sugar. At this point in time, you need to measure. Do I really want to take sugar?
Mm.
If I take it, what does it do to me? If
Mm.
I don't take it, will it kill me? So you must be able to say, okay, let me now, put in check
Mm.
how I used to eat, my quantity of food, the quantity of food I used to eat. So some people don't like vegetables before, but now that you're at this stage, you need to start eating vegetables,
Mm.
eating fish. You now need to start eating intentionally,
Mm.
like the food that will actually impact your life, positively. The food that impacts your health positively, intentionally,
Mm.
not just eating anything. But okay, I saw that today. Okay, let me buy it. I feel like not that I feel like eating this. Yeah, you can have a free day sometimes. Maybe once a week or so. Okay, okay, let me spoil myself. But you must now start eating intentionally.
Only.
These are the food that will give me, good health. That will help me. Not that anything goes. No, whatever does not go, whatever will not that will not contribute to your good health,
Health. Yeah.
then don't eat it or minimize it.
Mm.
Yeah.
Mm.
So the woman needs support in every area. Like they need the other husband to understand that this is why she's doing this. And I think the woman too needs to explain to the husband to say, look, this is what I'm going through. How can we help? Especially, I was talking about sex before.
Yeah.
When the woman, they have painful sex, they have, maybe they're now afraid or thinking, I don't really want to have sex. As a matter of fact, I think your libido reduces at that time.
Mm.
It reduces your sex, like you don't really want to have it. But
Okay.
if you're having issue with that, you can talk to your doctor if there's anything they can give or whatever it is. But let your husband understand, because the man can be thinking, he's not allowing me to touch her. He's not allowing me to, let them understand that, well, this is what you're going through. And so that's why they need to understand as well. So they don't think you're just running away from it. So that both of you can now say, okay, what can we do to make it pleasant? What can we do to make it, more manageable?
Mm.
So that they don't just think, oh, you're just putting it up, that I
Mm.
don't want to have sex. So the men need to understand it. Yeah.
Mm, thank you very much. I think that's very impactful because everything in marriage, both the men, whatever the men are going through, I don't know if the men go through a lot though, like women. They need to carry each other along, isn't it?
Yeah.
I think the issue of sex is an important issue as well. And yeah, because actually I'm even looking to discuss about that issue of sex because it's something we shy away, especially we the Christian. We don't like talking about it, but it's very important, because the woman needs to know. that my wife is going through this, like you said. Wonderful.
Mm.
So, men that is going to listen to this, support your wife when they are going through menopause. I used to say monopause, put it pause. That's it. So, it's not pausing yet. So, even though they are going through the pausing stage, please do support your wife. Any man that is going to come across this video, do support your wife and be gentle with them and be kind. So, what about women? Maybe during their menopause, they don't like to eat, they want to be fasting. What do you think about that?
Um, like I said, you need to watch the food that you eat. It's not about not eating at all.
Because
Because
some men don't
sometimes,
want to eat at all.
yeah, it's not, no, that's gonna cause more damage. That's gonna cause ill health. Because Nicole, I mentioned earlier on that you need to be eating some food, some
Mm,
diet that will nourish your bone, that will nourish your skin, that will nourish your, your brain. So if you are not eating at all, it means your brain, your skin, the organs in your body will not get the nourishment that they need.
mm,
So it's just like I said, just eat intentionally.
mm,
If you have to go to a nutritionist, that will advise you on those kind of food that you probably they might even be the food that you like. They
mm,
can tell you the kind of food, how to prepare those kind of food that will make you to still enjoy them and to still, have the nutrients that is needed for your body to be nourished.
mm,
So it's not about not eating at all. Not eating at all means that you are depriving the cells in your body, the bones in your body, parts of your body to be nourished.
mm,
So it's about eating the right thing. So I always tell people it's not about not eating breakfast, lunch, and dinner. As a matter of fact, it's very healthy to eat breakfast, lunch and dinner. But it depends on what you eat.
mm.
Some people eat once a day, and with that food that they ate once a day, the calorie is much, much more than somebody who had breakfast, lunch, and dinner.
Wow.
Yes. So it means that they are not eating breakfast, lunch, has not taken, has not reduced, their calorie.
Yeah.
So
Mm,
the calories you put in will determine the outcome,
mm.
you know, because maybe they're thinking or they're putting on weight. There are some people, no matter how much they don't eat, they still put on weight.
Yeah, true.
Because you're not going to fast forever, would you?
Mm-mm.
So after you fasted, when you come back to eating, your body will still take in the same thing because that's the state that you are.
Mm,
Just what I would just advise I would just want to give, no matter how you look during this period, just love yourself.
mm,
You are beautifully and wonderfully made.
mm,
I know that as long as you are doing your bit to eat healthily, as long as you are doing your bit to do exercise, as long as you are doing your bit to do all you can do to make sure that your body is healthy, it doesn't matter how you look.
mm. True.
Just love yourself the way you look,
Mm.
because it's not people that are going through what you're going through.
Sure.
But just be true to yourself that okay, I'm not eating junks,
Mm,
I'm eating healthily. If you have to employ a nutritionist, like I said,
mm,
to actually advise you on the nutrition that you need to be taking, then please do.
mm.
But don't hate yourself for the way you look. Don't say I'm not going to eat because one day you will still eat again and it's still going to come back to the same thing.
Okay.
But if you can eat healthily, you know the food you're supposed to eat, vegetables, eat low, salt, low diet salt, you know, because during that period, people are prone to having high blood pressure, prone to having heart disease, prone to having all these things. But if you can manage your diet intake,
Mm,
I think you've done your own bits. You've
mm,
done your own parts,
mm.
and let the process go on, and let it just pass by. But don't starve yourself because you don't want to put on weight and all those things. It depends on the food that you eat.
I eat. Mm. Wow. Thank you so much, Pastor. You know what? The last question I want to ask, you've already covered the ground. Because the last question was just talking about how can women talk openly about menopause with their health care provider to ensure proper care and support during their transition. So I know during that discussion you've covered a lot of ground, and even now we're talking about food diet, which is very important. Even when you're not going through menopause, you
Yeah,
still need to eat healthy, isn't it? And
yeah.
just to now wrap it up, how many months does it take, or years does it take to get to that full stop, to get that, okay, now I'm done? Because I know you said 12 months of menstruation. Once you pass that and you don't see it again, that is bye bye to menopause. But sometimes people will just see it again, pim, it just come back. So how many months can we be thinking about, okay, now I need to, maybe somebody that doesn't even like eating healthy before, or somebody that doesn't even like to eat breakfast, dinner. I mean, the lunch is only in the evening they want to eat, and because what, they just feel like they want to look good and they eat healthy for that once. And maybe some people that just like, they like to eat like picky because some people like to eat picky food. So now, when they now get to this period of premenopause, and now they're
Mm.
going through it gradually. So, how many months or years does it take to go through this phase?
Um, Everybody is different. Like I said earlier on,
Yeah.
everybody is different. Some people, they can just start now within their 12 months. I mean, within maybe a year, they've done.
Wow.
Some people is 5 years.
Yay. That one is long go. Why? God have mercy.
Some people can go to, there's nothing you cannot say, oh, this is the way. It depends on
Five
other
years.
factors. Some
Mm,
people, it might be 3 years, it might be, some people might go through, yes, it might be 3 years, it might be 5 years.
wow.
And some people, it might just be that year, just that year that they're going through it, and that's it.
And that's it. Wow.
And some people might not go through it at all.
Question is just coming to my head. Anyway, I'm just going to wrap it up now. And I want to ask this question. Does it really matter what age you start your period to get to transition to menopause? Let's say people believe that when you start your period earlier, let's say you started at the age of 19, sorry, 14.
14.
I started my period at the age of 19. So that
Wow.
was, yeah. Uh-uh. One of my mom friends started at the age of 21. So I'm not the only late one. So some people start at the age of 16, 15, and I think most of our children, they start at the age of 12, 11, and all those stuff. But so does it really matter the age you started your period? Maybe when you start your period, like you started 14, I started very later. Does it really matter the length of the time you start your period? That's going to be the length of time you're going to get to your menopause. Like we said earlier on, that some people are reaching their menopause in their 20s, 40s. I know some people have been seeing it in their 30s, the signs in their 30s, and now they finally stop even before they reach 50. So is it because they started their period earlier, or is it because they started their period later, or it doesn't really matter what time you start your period?
I think many factors will determine that.
Mm,
Some people, it might be because it's genetics. Like some people, it's like hereditary.
okay.
Maybe if you look at your family pattern, for some people, it might be, when their family, maybe that is when their mommy stopped, or it might be that. It might not be.
Oh, okay.
Some people. And for some people, it's when they have like ovarian surgery, like
Mm,
when they have ovarian, like I told you, like the ovaries that the ones is what produces estrogen and
mm-hmm,
progesterone.
mm,
So if they have surgery in
mm.
that ovary, the ovary might decide to perform, less effectively
Oh,
before the time. So,
mm,
or maybe some people, when they're exposed to toxins, like maybe some people have chemotherapy and,
mm.
all those things. It might be, or some people, when maybe they have infection, vaginal infection, like, it can determine it.
Mm.
Some people, it might just be like genetics for them.
Mm.
So different things can determine when you start having your, premenopausal symptoms.
Okay.
And some people, maybe some diseases that, they have, hyperthyroidism, hypothyroidism, all those things, it can
Mm.
determine. Yeah. So nobody can actually say, oh, this is what determines, but there are many factors that can determine, when you start having it.
Okay.
Mm.
Wow. Thank you very much. It's been a wonderful time and I really enjoyed this discussion with you. And I know we're going to bring more topics to discuss together. So I really appreciate your time. Thank you. And thank you for that wonderful advice. And if you want to say one thing, just finally, what will you say to ladies or women? Yeah, ladies, women, we don't want to call you women so that you won't look old, you're still young. Ladies out there that maybe they're now scared that, oh, I'm getting to my 47, because a lady said in her 47 she just stopped, the menopause just came and that was it, she's done. And she says she's happy to talk about it because, as we said, that some women doesn't like to talk about it. So what will you say to that woman? I mean, one lady out there, maybe now in their 40s and now this show of menopause, and they are thinking, oh, my auntie feel this way, they feel that way. So one advice or word of encouragement will you give that one lady
Mm.
that will be
What I
listening to
was,
this now or in future about menopause?
what I want to say is that no matter what stage you are in
Mm-hmm.
your life, whether menopause or not menopause, just take God along with you.
Mm-hmm.
Because when God is with you all the way, no matter what stage of life that you are,
Mm-hmm.
whatever you are going through, you know that you are safe
Mm.
because you are safe in His hands.
True.
So whatever you are going through, whether menopause or non menopause or whatever it is, just have God in your life.
Mm.
Because the doctor can try their best.
Sure.
They can even tell you, let's help you with this. What they give you might even cause you, you might have side effects.
Mm.
But when it's with God, whatever He does is beautiful.
Mm. Mm.
So just have God. Have God. It was the one that will lead you what to do, how to do, and and you'll be certain that because I have God, it dwells inside of me. This is the temple of God. One scripture I got from the Bible recently was that my body is the house of God,
Good.
and Jesus Christ is in charge of this house.
Mm-hmm.
So if Jesus Christ is in charge of this house, of His house, which is my body,
My body.
it means that no corruption. It
Mm-hmm.
means that whatever my body is going through, He knows about it and He can handle them.
Mm.
So that's one thing I've resonated with, that. Look, my body is a temple of God, and God, Jesus Christ, is in charge of this temple.
Mm.
So He's more than able to take care of it. So
Mm.
just rest in God. Don't panic. Hey, oh my God, hey, this period, just be restful. There was a time that when you can even start having like anxiety, like, oh my God, just calm yourself down.
Mm.
Because the hormones can take you to any level, it can want to take you. You just calm yourself down, knowing that your trust is in God.
Mm.
Because if you can't handle that period very well, where you start having anxiety, and it can lead to permanent anxiety, which is mental health.
Mm.
So
Mm.
just calm yourself down, knowing that Jesus Christ is in this boat. This boat cannot sink.
Mm.
So once you have Jesus Christ, you are sorted. And if you're out there, you're a woman, you are thinking, oh, I can handle this. You want to give your life to Christ. Please give your life to Christ, because He's the only one that can help you handle all things. Doctors
Mm.
can try their best, but they are not the great surgeon. They are not our God is the great physician. He can
Mm.
handle all situations. He's a
Mm.
specialist in all situations.
Mm. Mm.
So please, if you want to give life to Christ, you know, give your life to Christ. Ask God to forgive you. Invite Him into your life, and He will be there to help you.
Mm.
Amen.
Thank you. Thank you so much. Amen. Thank you. Thank you so much. As I said, it's been a wonderful time to host you, and I believe that this menopause topic is really going to touch people's life. And now people are aware that what we need to eat, what we need to drink, what we or what we should be expecting. And as Pastor Tonya said, if you're a woman, believe that, God is in your temple, which is your body. He's a
Mm.
temple, he's the one in charge. So give it all to him. So thank you so much, Pastor, for joining me this wonderful afternoon. I really appreciate it. So hope to see you soon. Bye
Thank you.
for now. Bye.